Hospitalizations in Mobile are on the rise once again as the number of coronavirus cases across Alabama continues to rise.
NBC 15's Rachel Wilkerson spoke to Spring Hill Medical Center's CEO today, and he expressed some serious concerns.
Kim and Greg, the concern is COVID cases are increasing and we're now in flu season. With limited ICU capacity, the system could get overwhelmed.
We probably have double the inpatient COVID population that we had just 10 days ago.
ICU beds are running thin at Spring Hill Medical Center. CEO Jeff St. Clair says the majority of the patients aren't in critical care because of the coronavirus, but COVID-19 cases are once again rising.
COVID hospitalizations are up. Hospitalization itself is up from the summer when COVID had its first peak, and I think that's because of delayed care, people avoiding healthcare systems because of COVID.
Right now, Dr. Scott Chavers with Mobile County Health Department says although cases are rising in our hospitals, we are still in the manageable stage. However, the system, he says, can easily become overwhelmed.
When you place influenza over top of COVID, and this has not happened before in the COVID pandemic.
If that happens, that means vulnerable patients might not get the quick care they need.
And if they're not able to receive that care, that's where our death rates go up. And that's what we saw in New York and what we're starting to see in other areas of the country, such as Idaho.
St. Clair says all of the hospitals have a surge capacity plan, but there are only so many beds and staff members.
The hope is that the demand does not exceed the endpoint, because then you have to find a place for these patients to be treated. And how can you do that when all hospitals are experiencing the same problem? So that's a concern.
Spring Hill Medical Center also says it's in desperate need of blood donations. Right now, visitation hasn't been a problem, but if cases continue to climb, then there's a possibility that they will have to limit visitation once again. The health department says a vaccination should roll out by the end of the year. I'm told that the general public likely won't have a chance to get one until spring. Reporting in Mobile, Rachel Wilkerson, NBC 15 News.